With diabetic retinopathy, damaged blood vessels in the retina begin to leak fluids and blood. When this fluid leaks, it can cause the macula to swell or thicken. This is called diabetic macular edema, or DME, and it is the most common cause of vision loss for people with diabetes.
The abnormal blood vessels can bleed into the vitreous, the clear gel in the middle of the eye. This bleeding, called a vitreous hemorrhage, can prevent light rays from reaching the retina.
To prepare for your medication injection, your ophthalmologist will clean your eye to prevent infection and numb it with anesthesia to reduce discomfort during the injection. Your pupils may be dilated or widened with dilating eye drops. The medication is injected into the vitreous, or jelly-like substance in the center of the eye. You may feel pressure in your eye when the medication is injected.
With focal laser treatment for macular edema, a laser is aimed at specific areas on the retina to seal off leaking blood vessels. The laser is not focused directly on the center of the macula, since this would affect your central vision. The goal is to reduce blood vessel leakage around the macula to help reduce swelling and slow vision loss. Your ophthalmologist may recommend several laser treatments to get the best results.
With non-proliferative diabetic retinopathy, or NPDR, damaged blood vessels in the retina begin to leak fluids, including small amounts of blood, into the retina. Sometimes deposits of fats may leak inside the retina. These deposits are called hard exudates. With PDR, many blood vessels in the retina close, preventing adequate blood flow to the retina. The retina responds to this problem by trying to grow new blood vessels. However, these new abnormal vessels do not provide proper blood flow. They can also bleed as well as lead to scar tissue, which may cause the retina to wrinkle or even detach. If similar vessels grow abnormally in the front of the eye, they can block the drainage channels of the eye and cause high pressure and possibly glaucoma. Both your central and side vision can be affected by PDR. With fluorescein angiography, a small amount of yellow dye is injected into your arm where it circulates through all the blood vessels in the body, including those in the retina. A special camera with a blue flash is then used to take a series of pictures of the retina. Any blood vessels that have been affected by NPDR will show up in these images, as well as areas of abnormal leakage or ischemia.
With OCT, a special camera is used to photograph your retina. It measures the thickness of the retina and is also very sensitive at detecting swelling and fluid. This diagnostic information helps your doctor determine why your vision is blurred and whether treatment should be started.
Vitrectomy surgery is usually performed in the operating room on an outpatient basis. An operating microscope and small surgical instruments are used to enter the inside of the eye. Blood and scar tissue are removed. At the same time, a laser may be used to prevent further bleeding and abnormal blood vessel growth. To help the retina heal in place, the ophthalmologist may place a gas bubble or silicone oil in the vitreous space. The gas bubble will gradually dissolve on its own. Removal of the silicone oil requires an additional procedure. Use of a gas bubble or silicone oil is reserved for eyes with retinal detachment or advanced scar tissue. After vitrectomy, the results of your surgery may not be apparent for months.